Welcome to the On Your Mind podcast, where we believe mental illness can be temporary and transformative. Stay tuned for innovative, effective tools from experts in the field of mental health. Hosted by Timothy J. Hayes, psychologist. This podcast aims to change the narrative around mental illness. Move from a place of fear to a place of hope and solutions. Here on Your Mind.
Dr. Kristin Reihman is a physician, a mother, and the author of Life After Lyme, a comprehensive do-it-yourself manual to making a complete recovery from an all-too-common illness. Having recovered herself from a debilitating case of Lyme over a decade ago, Dr. Reihman knows all too well what it is like to live with a body that feels like it's falling apart, a brain that's forgotten how to do simple math, and the fear that you're going to die from an illness that is invisible to most people. She also knows how to make a complete recovery and has done that for herself. Now she is on a mission to help as many people as possible recover their own most vibrant versions of themselves and get back to living their amazing lives. She shares her favorite tools, practices, and mindset shifts for the whole person healing process in her book, on weekly episodes of her Healing Grove podcast, and in the online communities she cultivates, including the Healing Grove membership, on Instagram, and in her latest offering, the Life After Lyme coaching program. Well, Kristin, welcome. It's great to see you again.
It's good to see you too, Tim. I'm happy to be here.
I'm excited to have this conversation. I'm hoping you could get us started by telling us a little bit about how you got involved in the work you're doing and what drives your passion for it.
Okay, so just starting with the small stuff.
Yeah. Just dip a toe in and then we'll go from there.
Okay, perfect. So hi, everyone. My name is Kristin Reihman. I'm a physician by training. I'm a family doctor, an MD. I'm also trained and certified by the Board of Integrative Medicine. And I got to this position because I wanted to help people. I wanted to find a path in the world that would allow me to use my gifts in service of my fellow man and woman, and doctoring seemed like the way to do it. I really went to med school to become an OBGYN. I thought that would be the best use of my skills, and I just loved the idea of supporting women in labor and helping families move through that sacred transition of becoming a family, enlarging their families. I thought seriously about midwifery school, because the more I leaned into learning about what OBGYN looked like, the more I felt like, wow, there's not a lot of normalization of this beautiful, normal, natural process, which in so many cases, more cases than not, is actually very healthy and easy and intense, but safe. Ultimately, I decided I needed to be a doctor in order to change the world in the way I wanted to change the world, which I think looking back, I'm like, wow, how did I know that there really, there wasn't much power for change agency within the larger context of Western medicine for midwives. But it seemed pretty clear from the midwives I was speaking to in Texas, where I was at the time, that it just wasn't going to be a pathway that I could use to make a change around how birthing was done. And I felt, again, that it was often medicalized where it shouldn't be. So I did that. I went into family medicine. I went to Stanford for my medical school, and then I came to the Lehigh Valley in Pennsylvania to do a residency in family medicine, because I had learned along the way that family medicine was kind of a perfect meeting place for someone like me, sort of a midwife in doctor's clothing. I could do birthing in the way I wanted to do it, supporting women naturally, helping them labor, being by their side, and not being rushed through the system in the way that I would have to be if I were doing it as an OB. And I loved that. It was what made my soul sing. And my patients had my cell phone number, and they would call me when they were in labor, and I would get up in the middle of the night and go be with them as they delivered. And it was beautiful. It was really sort of a high point of my career, my early career, until I got Lyme disease. And Lyme disease changed everything for me. I couldn't wake up in the middle of the night anymore. I had to sleep 12 hours a day. I could barely focus on, my life as such as it was. And I was, a young faculty attending in my program, and I was, creating all these different, group acupuncture visits and centering pregnancy, birthing groups. And it was everything. It took everything in me just to sort of to be alive for 12 hours a day. I was in a lot of pain. And I ultimately gave up OB and my practice of delivering babies because I couldn't even manage my own health. And that was a hard loss. But ultimately what that led me to is what I'm doing now, which is supporting people in another sacred transition, which is a transition between being ill. Most of my patients have some kind of complex mystery illness like Lyme, back to a version of themselves that is, vitally, robustly alive. So I feel like in some senses I'm still being a midwife,
Right. Right.
um,
Assisting
but in a very
rebirths.
different
Right.
way.
I remember reading in your book, you got an ebook about this journey and where you've come. And I remember reading things like that it had such intense mental components for you that, forgetfulness and looking for your car keys and then finding them in the car that's still running and wondering, because it didn't always just the symptoms didn't just come and stay, they would come and go. And then you were left wondering about your sanity. And so, how did you find out, that this is it? This is Lyme doing this. And how did you start the journey to build your own health back?
I feel really fortunate, Tim, in that I had been prepared for that illness and the discovery of what it was by a patient of mine. She was a woman in her 50s who had been an artist model and still was an artist model, but found she couldn't do that work because she couldn't pose without urinating. She had no bladder control. And she had a lot of other symptoms too. She had severe brain fog and panicky feelings and racing heart and terrible pain in her feet and just exhaustion. And she came to see me in the clinic I was then working in as part of the residency in this inner city clinic. And she had been to many, many doctors in the network. And she said, we had the whole intake. I heard all of her story. I heard all of her symptoms. I had no idea what was going on. And I told her that I didn't, but I was willing to partner with her to try to figure it out. And she said, from all my research, I'm confident that I have Lyme disease plus some co-infections. That word was new to me, but basically other things that travel with Lyme, Babesia, Bartonella. No doctor I've seen believes me. So if you want to be my doctor, you have to read this first. And she pulls out this stack, of internet research that she'd printed out and hands it to me. And there was this moment where I just was like, am I going to take this? Because if I take this, I have to read it. And everything in me said, yes, you must take that and you must read it. And so I did. And of course, it was eye-opening and horrifying because I realized as I was reading these published papers of, people who'd had Lyme disease, like diagnosis of Lyme, treated for a month or even 10 months with IV, ceftriaxone for Lyme disease, which was at that, in terms of the Western model, considered overkill. And then 10 years later, culturing live Lyme spirochetes or bacterium out of their knee. My head was exploding and my heart was breaking as I was thinking about all the people I had dismissed saying, well, you can't possibly have Lyme because you've been treated or because the test is wrong. And of course, I'm also the test was missing 60 to 70% of Lyme. So I was really having this kind of shocking, rattling awakening and realizing, well, yes, of course I want to help her and I want to learn what I need to learn to re-educate myself around this. And be the doctor she needs for me. And in the process of that, of working with her the first couple of months, I was bitten by a tick. And a couple days after that, I had a bullseye rash, which is considered the pathognomonic or classic, can't be anything else sign of Lyme disease. And I was like, wow, well, here I am. I guess I'm going to learn on myself too.
So, the serendipity, some would say, right?
Yeah.
As fate would have it, not only did you get to help her, you got to help yourself and then lots of others. One of the things I'd like to have you talk about is the wide range of symptoms, the physical and the mental, emotional, that can come from Lyme that most people, as they're hearing this, unless they've been researching Lyme disease, they won't be aware of this.
Yeah. It's really one of those things that can, affect every limb of your tree, as I like to say. And in that regard, it was a wonderful education for integrative medicine. Integrative and holistic medicine looks at the whole person, not just the physical organs and tissues and pathways, but the person as a social being, and the person in their community, the person in their spiritual world, the person in their mind. What are they thinking? What thoughts are they thinking that are contributing or detracting from their ability to heal? And so, in a sense, it was kind of the perfect step for me. And again, a synchronicity, and something that I'm grateful for, because it was a wonderful education for me as an budding integrative doctor. But yeah, any symptom really that you can imagine. Lyme is classically thought of as something that affects the joints and the heart and the nervous system. And that's a lot right there, right? Think of all the joints we have in our body. And it can affect any joint, and it often moves between the joints, creating inflammation, redness, pain, swelling at different joints at different times. It can also impact your brain or any nerve in your body. So sharp stabbing pain in your left toe could be Lyme disease, as could brain fog, as could speech problems, as could what appears to be a transient stroke. So, and of course, then heart attacks, more commonly arrhythmia. New right bundle branch blocks, for example, are considered classic for Lyme, which is a type of aberrant pathway of the rhythm of the heart. And so those things are the common kind of textbooks things that physicians learn to recognize and, answer questions about on their board exams. But it can also create out of the blue mental illness, with no other symptoms, no other physical symptoms. So depression, anxiety, OCD, it can create panic attacks. It can create Pott's disease, which is a problem with the autonomic nervous system that leads to people's inability to stand up without feeling very faint or passing out, and sometimes just passing out while sitting down even. Their blood pressure and heart rate can't respond to changes in position because the nerves that go to the autonomic nervous system nerves that feed and innervate those organs and those, blood vessels and heart don't respond appropriately as they should. It can create all sorts of physical pain syndromes, including things that are very discrete, like an ache in the back of your left leg or your right leg in the muscle, or headaches or bone pain anywhere. Lyme is a close cousin to the spirochete, or the spiral-shaped bacterium that causes syphilis. In its time, syphilis was known as the great imitator because it could imitate pretty much any other known pattern of disease out there. And Lyme disease is 14 times more complex genetically than its cousin syphilis, and absolutely is the new age, great imitator.
And so most people, and myself included until I read your book, think that the only way you get Lyme disease is a tick bites you.
Yes, that's also sort of a board's question. In fact, you have to know the deer, and you have to know, the deer that's a vector in nature, and you have to know the actual vector, which is the tick, and also the mouse that's involved. And the truth is, that's a very reductionistic approach, because Lyme disease, the bacterium that causes Lyme, has been found in bird poop. It's been found in fleas. It's been found in horseflies and spiders, black recluse spiders. It's been found in all the different ticks, not just the black-legged tick or Ixodes scapularis. It's also been found in semen and breast milk and the placentas of miscarried babies. So I think to imagine that just because we don't remember a tick bite, or we don't live in the part of the country where this particular tick likes to roam, well, our symptoms can't equal Lyme is, problematic.
So now let's say that somebody's lucky enough to find a description like this, or to land on the option that it might be Lyme, and then they find someone like you. How do you help them? What's our, assuming that you're talking to people who know nothing about Lyme and how to treat it,
Mm-hmm.
where do you start?
Yeah, I would say start with my ebook, because that really was a labor of love and an effort to download everything I knew at the time. That was 2018. That was published
2018.
about Lyme disease. And it's, 99% of it's still, what I'm doing and thinking. And it's such a helpful framework that really integrates a lot of naturopathic medicine. I'm not a naturopathic doctor, I'm a medical doctor, but I've really learned a ton from the naturopathic community about the importance of the body's ability to detoxify itself, how to support the organs of elimination and detoxification. Because, treating Lyme disease at its core is really a balance. You're trying to empower the immune system to just do its job. Like it really should be able to just fight off infection. I mean, we saw this with COVID, right? Some people were exposed to COVID, got COVID, never felt a symptom, right? Whereas others died or had incredibly difficult journeys through COVID. And it really comes down to a series of host factors that determines whether someone gets super sick from Lyme, doesn't notice they have Lyme and just kind of wall it off and harbor it for life, or whether they need support, antibiotic support or herbal support or some other support to kill the bugs, because their immune system really should be killing the bugs. So what I would say is it's a journey and it's a dance, and it involves really thinking about the immune system as your primary vehicle for dealing with the Lyme infection. And then everything you can think of to do that will support it, on all limbs of your tree, right? Physical support for the immune system looks like adequate sleep, excellent nutrition, getting the allergens out of the diet, getting the inflammatory foods out of the diet, making sure you're exercising. But then there's all these other pieces that can help your immune system thrive that include how socially connected are you? Are you hanging out with a bunch of people that raise your fear level or that dismiss your symptoms and gaslight you? Like that's not actually helping you heal. That's undermining your own immune system because of all the stress that causes. Conceptually, what sort of thoughts are you thinking? Are you telling yourself a story that you're going to die or that you can't possibly heal? That's not actually going to help you get better. There are much better stories that are going to be more effective for healing if that's your goal, and so on. It's really important for people to kind of embrace the holistic approach, I think, so that they can really give their immune system every little nugget of nourishment that it needs to do its job. And sometimes there'll be antibiotics involved. Sometimes there'll be herbal or other therapies involved. And I describe my favorite ones in my ebook. But you probably remember, I don't get to those therapies until chapter 9.
Right.
I believe everything else is foundational. And I have patients for whom they never need to get to antibiotics or herbs because they did an elimination diet, which I covered in chapter 4, and they got the allergens out of their food and they got the inflammatory things out of their foods, and their immune system jumped back to life and then did the job.
When you say that, I flash back to what you were talking about earlier when you're saying that the symptoms from Lyme can actually look like no physical symptoms and all of a sudden a mental health issue. And I'm wondering if if the best guess around that is that what's happening is inflammation in the brain that is promoting that, what we call mental health issues, the anxiety, the depression, the obsessive thoughts, et cetera. Is that what we're guessing?
Yeah, and there's some evidence for this as well. You can do a spinal tap and look for evidence of white blood cell count raising or even bacteria in the spinal fluid, and that's pretty clear evidence that there's inflammation in the brain. There's also a test called the Cunningham panel out of Moleculera Labs that looks for 5 different antibodies that are made against different areas of the brain, often in response to an underlying infection in the body. So you could have an infection directly in the brain. You could also have infection in the body that creates an antibody response. And those antibodies, those proteins that are designed to kind of go out, search, find the intruder and tag it for removal and kill it, those can also cross-react with different areas of the blood-brain barrier. And if the blood-brain barrier is leaky, as it often is these days because of all the cell phone use and the inflammation in general in our bodies, then you have a real problem. And you can get new onset tics, for example, tic disorders. You can get OCD. You can get anxiety, panic, things that are completely new for you because you now have new inflammation in the brain.
Well, and it is, I suppose it's been only about 7 or 8 years since I ran into some functional medicine specialists that started talking about, and psychiatry, right? So medical doctors, functional medicine trained, that were talking about inflammation in the brain leading to a lot of the symptoms that they're trying to just tamp down with things like antidepressants or anti-anxiety agents, and getting, very limited success because they're not reducing the inflammation.
Yeah. And there's good research on this now. I mean, it's if you're looking for it, you'll find the research that shows that there is pretty much always inflammation in the brain of someone who's depressed.
And so are there standard kind of blanket approaches to try to eliminate that inflammation other than things like what you were saying, the elimination diet, getting rid of foods that might have an allergic type response in a person? Or
Well, standard is an interesting word. I would say in the community of people who sort of operate in the functional medicine space, absolutely. And elimination diet is probably top on the list. Basically removing the toxic things from your body or brain in that case that can be creating and driving that inflammation. And food is one of those things that we have, a lot of us have really mixed emotions about and connections to and strong, feelings about, changing, but it makes a difference what we put in our mouths, 3 times a day or more. And if we're putting in things that are gonna inflame the gut, the lining of the gut, stir up and produce different pathogenic categories of microbes in our microbiome, all these things talk to the brain back and forth through the vagus nerve and through the bloodstream. And so it's important to realize that we are dosing ourselves with either chemicals and harmful toxins every day or with nourishing foods that are going to, create a much better milieu for health.
and that milieu is the actual soup that our brain has to function in, right? This whole one of the weirdest things about us as people is that if the organ that we're using to interact with the world gets affected, we may not even notice. And
Oh
that's
my
why we're
gosh. So
walking,
true.
naked through the streets at 3 in the morning, thinking we're perfectly normal, and people are saying, "What's the matter with you?" And but to the person who's in that space, it seems like the perfect thing to do. And that's
Yeah.
why people who have real serious depressive issues, they have thoughts that a year or two before, if they'd had that thought, they would have run to the doctor. But now, a year later, their mind is they're having that thought all day, and they're thinking, "Yeah, this makes sense." It's a
Yeah.
really negative, really, dismissive thought, but for whatever's going on in the brain chemistry, it seems perfectly normal.
Yeah. Yeah. And it's a difficult problem to get around, which is why I like to encourage people to really build their healing team. Like surround yourself with people who know you, who love you, who can speak truth to you when even when you're being resistant. One of the people who was on my healing team was a fellow colleague, a fellow integrative doctor, a friend of mine who, when I was in the throes of my Lyme disease experience, I just became really hopeless. I became really kind of defeatist, kind of fatalistic about it. Like, look, this is just who I am now. And she was like, no, this is not who you are. And we're going to get you some help. You need to see my chiropractor. Or you need to, she kind of like took the reins and started managing my schedule a little bit until I could kind of come up out of the weeds and be like, "Oh, right, right, that's not who I am."
Yeah, I often wish that people could view what's going on in what they take in, both through their eyes and ears and through their mouth, and the skin, of course, and view that with as much importance as a couple shots of alcohol or a hit of a toxic or a really influential drug like cocaine or heroin. Because when you get that kind of shift in the body chemistry or inflammation, it has as much distorting factor in your thinking as being drunk or high.
Yeah,
Right there you were thinking, "This is it. I'll never get any better." And it made perfect sense to you to just sit there in misery. And it took somebody else who wasn't under the influence of everything that was going on in your system to be able to look at it and say, "Oh no, this is a separate thing, right? This isn't your
yeah,
true nature."
yeah,
And
yeah. I work with a group. I work with the Family Hope Center. I'm their medical director, and in that capacity, I am oversight. I provide oversight for the programs of children with special needs and brain injuries of all kind. Really, we call any brain not functioning optimally a brain injury or a hurt brain, with the idea that anything that's hurt can get well again, but you have to know what to do, right? And it's a conversation that I often have with parents who are coming in and saying, "Well, in our country," we have a lot of families who come in from Norway and Denmark, and they say, "Well, in our country at 18, this person's an adult, so we want to let him drive. We want to let him drink alcohol now. We want to let him." I said, "Listen, you know from your work with us that his brain is not an 18-year-old's brain. His brain is hurt and he's still an 8-year-old. Would you let an 8-year-old drive a car?" would you let an 8-year-old drink alcohol? Like, we have to respect what the brain is showing us in terms of its capacity and strengths and work with where we're at until we can get that brain back online. And I think a lot of people don't want to hear that because, well, it's not a family hope. They're on the path with us, but a lot of people have been raised to believe that once a brain injury, always a brain injury. I mean, I'm living proof that, you can recover from a brain injury. My brain was really offline for a lot of my Lyme illness. I, as you said, I would leave the keys in the car. Like, should I have been driving a car? That's a whole other question, right? Like, couldn't remember where they were. The car's still running. I was seeing patients for much of that time, and yeah, not good, not good. And
Well,
nobody wants.
you and Evan Alexander, do you know that name from his?
Not yet.
He had an infection all through the brain that completely shut him down. Is legally dead for 7 days in a coma and all that, and he came back.
Wow.
Who's the woman? My Stroke of Genius.
Oh yeah. What's her name?
Her name
I
will
could,
come to us, but she's got the same thing where she, as a brain scientist herself, was trained to believe if you had a stroke and you got stuff back in the first month to 6 months, that would be all you'd get back. And if it hadn't come back by a year, you're never getting anything back.
yeah.
And yet she has watched herself 7, 8, 9 years after her stroke regain functioning. So
Jill
she's
Bolt.
helping. Yeah, Jill Bolte Taylor. Yeah. And she's rewriting what, the truth is about brain injury.
Yeah, in medical school, I remember learning that, the right answer for the boards is 6 months. 60 days to 6 months is what your brain has in terms of its ability to recover. Like, that's such a clean number. Really? The brain just stops recovering. Yeah. Turns out that's what insurance will pay for, right? Usually 60 days.
That's it. Right. Right.
Yeah.
And, books like The Brain That Heals Itself,
Mhm.
the tremendous amount that's in just the past 15 to 20 years, that progress they've made in trying to overcome the old idea of one location is responsible for one function in the brain to this. Now it's practically a buzzword to talk about neuroplasticity, but to understand at different levels how it's the ability of the brain to fix itself, heal itself, learn new things is far more robust than they imagined.
Yeah. And it's not actually rocket science. Like, it doesn't actually take that much. It's a lot of basics. It's pretty cool.
So I'm noticing the time here and thinking I don't want us to be too rushed here at the end. So let me just ask you to get centered and think. Considering your ebook and considering the other work you do, is there something that we've already talked about you want to go back and highlight, or something we haven't even touched on yet you want to bring into the conversation?
Well, I think we've got a good start on the brain healing conversation, and there might be more to say around that. I don't I'd be happy to share my story of my second brain injury if you'd like to hear it
Sure.
and of what I did. So, yeah. So, 2 years ago in 2022, I decided to have surgery on my neck because I'd had about a year and a half on and off of incredibly painful left arm symptoms and actually left shoulder symptoms. And I thought they were musculoskeletal for a while. And it turns out I had some herniated discs and they were impinging pretty strongly on some nerves. And I did physical therapy for 6 months and it got better. Then it got worse again. And long story short, I opted for surgery, which I never really wanted to do because I'm kind of over the belief that I need surgery ever again. But I was in excruciating pain, Tim, and I was on my couch for 2 weeks and not working and sleeping with my head hanging off the couch so that I could open up that space, and I was on 4 medications. I mean, it was and I was doing all the other things I do, I was doing energy work, I had a shaman, I was doing all my things, and it was just not even touching it, my eyes were crossing, because it was so painful, and I had surgery, and my pain was instantly gone, which was great. My voice was also gone, which was kind of a bummer. It came back, but what also happened is that my ability to multitask was gone. My ability to stand upright with my eyes closed and my arms out in front of me was gone. I would fall over to the right. My ability to walk downstairs with my dogs around my feet without panicking was all gone. So, and my right eye was turning out. So I basically had some little strokes during surgery or closely after. And that was
It's nice that you can say little. It wouldn't seem so little to me if all of that was going on.
You're right. They were small enough that the MRI didn't see them, but they were significant for me.
Yeah.
They were significant. And I had another one of those moments where I was just like, I don't really need my brain anymore. I'm gonna just retire. I'll be a fun grandmother eventually and I'll garden. And my family was like, nope, nope. You need to get back to yourself, and then you can make decisions about whether you want to retire and garden only. And so, and in fact, that same doctor who had pushed me the first time was instrumental in getting me in to see a functional neurologist. And within, a week or two of intensive therapy with this neurologist, my motivation came back. My lights came back on. I was like, oh, right, we're going to heal this. And then I embarked on a 9-month program that was based on the work that I'm familiar with from my work at the Family Hope Center, which we do with mostly kids. But I had used that program for my own last 2 children. I have 4, and my last 2 children, I used this program for a couple of years on and off just to help their brains get a little more focused and tighter and lose diagnoses like ADHD. And I believed in it. I mean, I knew it worked. It wasn't easy. And I think that was part of my resistance, before I jumped into the ring with it, was that I knew it was going to be really hard. And I was like, I'm tired. Like, I don't really want to do
right.
that.
When you have all that, you don't have the motivation or the energy to take on something hard.
Yeah. And so the functional neurologist, really kind of jump started me. And then I came home, and for 9 months in 2023, I did the program, which I'm happy to tell you what it was. But long story short, my eyes straight now. My multitasking is back, and I can stand and close my eyes and, shampoo my hair in the shower with my eyes closed without falling over and getting another head injury. So it totally worked. My brain is back. So I think that's what I would want people to hear, is that, there's never a dead end. Like, if you're alive and you have a pulse and your brain's still there, like, there's a lot you can do.
Excellent. Yeah, it's Norman Doidge was the author. I was thinking about, The Brain That Changes Itself. He's got a couple other books too.
Yeah.
But in reading those books, I was just so enheartened and uplifted by the thought that this is getting out there. People are actually, bringing the message that you just ended that story with, that if you've got a pulse, if you're still alive, because there's all kinds of stuff that can happen and change for the better, even in the brain, where they were saying for years that any loss of brain functioning and that's it. I mean, I remember being in undergrad school and being taught that the nerves in your body are the only cell that don't heal or recover. So
Yeah.
you could damage anything else, but if you damage a nerve, that's it.
I remember the same teaching. And what's interesting is that halfway through medical school, that story changed.
Yes.
Because a couple papers came out, front page of like Cell and Nature and Science, I think. And it was like, oh, never mind, rat brains are healing, rat nerves are regenerating. I remember taking one of those, papers, one of those magazines to my neurology rotation as a med student, being like, what are we doing about this, you guys? This is amazing. Are you so psyched? This is your field. And they were like, oh, pipe down, medical student. Nothing will happen with that for 20 years. I was like, what?
Yeah.
It's relevant to people now. Why are we not doing what needs to happen? But it turns out all the while, they were doing that at the Family Hope Center. They were doing that at other places. And I wish people knew more about the simple tools you can use to effectively invoke neuroplasticity, basically, and heal your brain.
Well, Feldenkrais was doing it decades ago. The Handel Center was doing things like that. The various ways that simple things can help people, get stimulated and I'm looking for a better word. It is helping boost my optimism because, on the one hand, there is still the old school that says in order for a new science knowledge to take over, the old scientists have to die off, right? Because it's that slow moving in its progression, and there's all kinds of things that have been demonstrated. I mean, even in the realm of with quantum physics, that have yet to make it into the medical field, or the recognition of the energy levels rather than just this thinking of this as solid physical, and which then really puts people's brains in a little trap that says, well, if you're just physical and there's only so much you can do, when, as you were just saying, there's all kinds of stuff that can happen, all
Yeah.
kind of growth and healing and repair.
And, I think as long as the old guard doesn't move to TikTok and try to take over there, you know, people are sharing so much of this information now on social media. And I think the old generation's just not going to be able to participate in the conversation in the same way, which, has its downsides. We're losing a lot of elder wisdom that might also be transmitted there, but we're also, fresh ideas and sort of like grassroots empowerment is pretty awesome.
Well, it was sometime in graduate school when I'd gone through yet another round of being taught in school, this is what we know. And then a year or two later, oh, wait a minute, that's not quite right. And by the time that happened in high school into college, and then college into grad school, and then from grad school and postgraduate studies, I finally reached the point where I started saying, it's just so much better for me to say, when anybody asks me a question, well, this is what we think we know now based on the best we have. It could change, right?
Mhm.
Because it does change.
It will change. It likely will change.
Yeah.
And a lot of people don't like that. They want the certainty. They want the pill. They want the thing. Well, the pill is really just the illusion of certainty, I think, the illusion of control. But they want to have that thing where they can sort of tuck it away in their head and be like, mischief managed. I don't have to think about that. I don't have to be anxious about that. And maybe that works for some people. But I like to dig in and find out, I like to explore and experiment and try
Well,
new things.
and
Won't
and
hurt you, but could help.
I love the little Harry Potter Easter egg you just dropped in there. So with your
That was
mischief
for you,
managed.
Tim. That was for you. I pegged you as a Gryffindor, so I just went for it.
Okay, so we are getting close to time here. We are going to promote and tell people about your ebook, and we are going to, offer you a way to let people know how to reach out to you. But what's kind of the big message going out the door you want people to take? What's the empowering position that you want to offer people?
You're never too far gone to heal. Like it's never too late to learn something new and try something that might be completely transformative. When I was sick with Lyme, I was in my bed, lost 30 pounds that I didn't really have to lose. I couldn't think or remember anything. And I thought I was over. And I wasn't over. I couldn't see that then. But I want people to know that they're not over either. Like, the journey that you're on, if you're in a particularly yucky place right now and you feel like you're just falling apart and you don't see the options out, that doesn't mean there are no options. It just means that right now you can't see them. There are always options. There are always people who are eager to help you on your path and join your healing team. So don't give up hope.
Yeah, when you say there are always people, I was just thinking that when you're in the position where you can't see it, but you've heard enough people like Dr. Reihman tell you, hey, there is hope. You can remember that and then find some other people who can be your cheerleaders or be your coach or be your transportation, right? Or be your set of eyes and ears when you're looking at these articles or getting information from doctors, because as you talked about, I think pretty darn well, it takes a team, especially when the person who's at the center of it is feeling so out of sorts and their resources are unavailable to them until they start to heal more.
Yeah, exactly. You are the quarterback of your game, but sometimes you need someone else to whisper the plays in your ear and give you a pat on the shoulder and be like, "You got this."
Excellent. So if people want to reach out to you, what are the various ways that you'd like to have them connect with you?
Well, they're welcome to come find me on Instagram. I'm there and I usually answer questions and chat with people there a lot. It's Kristin Reihman, MD. I'm also on, I have a website, which is kristinreimanmd.com. And there you can find my ebook. You can also find access to the various offerings and services I provide, including coaching programs for people looking to find their way out of mystery illness.
Excellent. Well, congratulations for both recoveries of the brain
Thank you.
injuries and for doing the work you're doing. It's great to finally get connected. I know that we had a run at trying to get connected a few years ago, and I'm so glad that there are people like you out there doing this work and that you're willing to share your time with us. Thank you.
Thank you, Tim.
Dr. Kristin Reihman is a physician, a mother, and the author of Life After Lyme, a comprehensive do-it-yourself manual to making a complete recovery from an all-too-common illness. Having recovered herself from a debilitating case of Lyme over a decade ago, Dr. Reihman knows all too well what it is like to live with a body that feels like it's falling apart, a brain that's forgotten how to do simple math, and the fear that you're going to die from an illness that is invisible to most people. She also knows how to make a complete recovery and has done that for herself. Now she is on a mission to help as many people as possible recover their own most vibrant versions of themselves and get back to living their amazing lives. She shares her favorite tools, practices, and mindset shifts for the whole person healing process in her book, on weekly episodes of her Healing Grove podcast, and in the online communities she cultivates, including the Healing Grove membership, on Instagram, and in her latest offering, the Life After Lyme coaching program.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.